All right, we're working for you tonight with the MedStar Health Cancer Network, talking about colon cancer and screenings. And joining us now in the studio is Dr. Stephen Fleischer, the Regional Director of Gastroenterology. Doctor, thanks so much for coming in and talking with us.
Great to be here, Kelly.
All right, I'm going to put myself out there. I know that I need to schedule that colonoscopy, but I've been kind of skittish about getting it done. But we're hearing about the procedure. Is it better than what it used to be?
So it's much better than it used to be. In days gone by, people would have the procedure under what was called conscious sedation. Typically nowadays we have much deeper sedation, and so predictably the patient's going to be comfortable and unaware of the proceedings going on around them at all during the procedure. In addition, there are many more choices as far as bowel preparation goes. And so you're able to talk to your physician pretty carefully about what it is that might suit you and what's going on with your digestive health, and make a tailored program that'll help you get through what is arguably one of the stumbling blocks that patients kind of feel apprehensive about in getting the colonoscopy.
People are more skittish or concerned about the preparation than actually having the procedure done.
So this is true. But one needs to keep in mind that it's very safe and very effective. And if you have a strong mindset and can, orient yourself to keeping an eye on the prize, so to speak, and the benefit of the procedure, most people can get through that and have a good and rewarding experience.
How long does it take?
So typically the procedure, if everything goes well and there's a good bowel prep and the colonoscopist can see where they're going and are able to identify things with ease and move the scope around easily, the procedure can be over in 10 minutes of actual procedure time. But if we find polyps or precancerous lesions that we need to remove during the procedure, then that will add on time to the procedure, usually not more than half an hour though.
How effective is this as a screening tool?
So this is highly effective as a screening tool. When compared with the reduction in risk that you get from other forms of cancer prevention, colonoscopy offers one of the highest risk reductions specific to a cancer out there.
Okay. And again, you have to drink the preparation. Is that like a 24-hour period in terms of prepping yourself for the test?
Right. So the colon preparation actually begins a few days before, where you want to change your diet a little bit. And then the hard work begins the day before, where you drink clear liquids only. And then subsequently in the evening, you're going to take the bowel prep. And it's very important, a quality metric these days, to do a split dose. So you take half of it the evening before and another half about 5 to 6 hours before the colonoscopy. And this gets you the best quality bowel prep.
Okay. All right, Dr. Fleischer, thanks so much for coming in. I promise I'm going to schedule that. I promise. We are taking your calls. The number to call is 410-481-2222. And our operators from the MedStar Health Cancer Network are going to be there till 6:30. Mallory?
Thanks, Kelly.